All right. Hi, everybody. Thanks for being here. We're continuing to celebrate the Global Journal and special issue, Surf Therapy Around the Globe. I'm Chris Primacio, Director of the International Surf Therapy Organization, a 501c3 nonprofit. We're promoting program standards, ethics, risk management, plus facilitating outcome research on the efficacy of surf therapy programs. ISTO's transforming the surf therapy space from all of us working alone into a cooperative effort and collaborative movement. And we're enabling more access to inclusive, safe surf therapy. Today, it's my pleasure to introduce these groundbreaking researchers, Nick Otis, a senior research associate with LIDOS at the Naval Health Research Center in San Diego. He's primarily interested in the impact of geography on health, such as the effect of natural environments on psychological outcomes and the nuances of locality on nutritional outcomes. His current work with Dr. Kristen Walter focuses on environmental exercise, psychology, surf, hike, and other activity-based therapies for those with major depression and PTSD. Kristen Walter, welcome Nick, Kristen, PhD, a clinical research psychologist at the Naval Health Research Center in San Diego, California, where she investigates the treatment of post-traumatic stress disorder and conditions that commonly co-occur with PTSD, such as major depressive disorder and traumatic brain injury. Dr. Walter, who doesn't want to be called Dr. Walter, but I'm calling her Dr. Walter, explores both evidence-based treatments and PTSD, co-occurring conditions, as well as complementary and alternative approaches. She's an investigator on several Department of Defense funded trials, including randomized controlled trials comparing evidence-based psychotherapies for co-occurring PTSD, MDD, and another comparing two activity-based interventions, surfing and hiking therapy. She's also a privileged clinical provider at Naval Medical Center in San Diego and a licensed psychologist in the state of California and Ohio. Betty Michalewicz-Kragh, I messed that up, Betty. Betty, repeat that when you come back on, my girl, is an exercise psychologist. And in 2008, while working with her patients at the San Diego Naval Medical Center, a combat injured soldier who had lost an arm and a leg had asked to go surfing as part of his rehabilitation. That success together and easing his transition into a new chapter in his life became the foundation for the center's surf therapy program. For over 11 years, the program has provided surf therapy to thousands of wounded, injured, and ill service members. Many of these wounded warriors became avid surfers, using it as a holistic way to manage post-traumatic stress disorder, major depressive disorder, and other medical conditions. Through surfing, many found a new sense of belonging in their lives. Gosh, welcome to all of you, and thank you so much for being here. Betty, say your name again.
Betty Michalewicz-Kragh, and I'm an exercise physiologist.
Physiologist. That's right. I'm going to blame being sick. I'm turning this over to you, Nick. Hi.
Hello. Yeah, so I think to start, we have a bit to talk about and cover in 35 minutes, but I think to start, since the topic of the paper focuses on comorbidity, or co-occurring symptoms, co-occurring disorders, in this case, PTSD and major depressive disorder. I'll start off by asking the resident expert, essentially, Kristen, what psychological comorbidity, I'm not sick, but what psychological comorbidity is?
Sure, that's a great question. When we think about psychological disorders, we often think about a single disorder. PTSD or post-traumatic stress disorder, major depressive disorder, generalized anxiety disorders. We think about them often in isolation. However, more often than not, psychological disorders actually co-occur with one another. And we know that among the disorders, PTSD is very likely to come along with other comorbid conditions. The common comorbidities with PTSD are major depressive disorder, or MDD, and substance use disorder. And even more specifically, we know that about half or 50% of individuals with PTSD also have major depressive disorder.
So why do these psychological comorbidities happen?
That's a great question. And there's several different reasons why they can co-occur. The first is that oftentimes when we think about a traumatic event, we think the only outcome is PTSD. But psychologically, that is not the case. People may just develop specific phobias. They may develop major depressive disorder as a result. So both PTSD and major depressive disorder can be the outcomes of traumatic events that people experience. It's also possible that one disorder either comes before or leads to the other. So say, for example, somebody experiences a traumatic event, they go on to develop PTSD, they may very well be avoiding people, places, activities in their life that used to be very meaningful to them. And they avoid these things to avoid reminders of the trauma. But in doing so, it may allow them to feel depressed, to not have things to look forward to not get reinforced by their environment. And so depression may follow after that. Other times, perhaps somebody is dealing with depression and some traumatic life event happens. And so the depression may have been there prior to the PTSD. The other thing I should mention is that there can be causal factors, they can both co-occur, but there are symptoms that overlap between PTSD and depression. For example, sleep problems or negative thoughts and emotions about the self and others. And so sometimes there can be two disorders that exist there, or it can be difficult to discern if there is one disorder or two going on due to the symptom overlap. So for a variety of reasons, these disorders can co-occur with one another.
What is the importance of these two disorders co-occurring together?
Absolutely. When we look at individuals who have PTSD and major depression versus just PTSD alone, we know that individuals with the comorbidity have higher symptom severity, greater impairment, and poorer outcomes than those with a single disorder. There are evidence-based treatments that are available to treat single disorders, such as PTSD or depression, and sometimes they have an effect on the comorbid symptom. However, there are very, very few psychotherapy options that specifically target psychological comorbidity. And given that we know that there's greater impairment, that comorbidity is more common than it isn't, it's vitally important for us to identify what are the best treatment approaches for individuals with comorbid conditions and how can we most effectively treat their symptoms and impairment.
Mm-hmm. Yeah, and I think in this regard too, there are, of course, in addition to some of the evidence-based treatments that you mentioned or that maybe you'll discuss later, is that there are also various singular studies, systematic reviews, and other large meta-analyses that have concluded that there is, while still ongoing, there's still enough high-quality evidence to show that exercise reduces symptoms of PTSD and reduces symptoms of major depression, kind of both siloed, and that exercise should be considered, with confidence in care plans. And so kind of one example of this, in our case at ISTO is surfing or surf therapy. And perhaps, maybe on the Zoom call right now, we have someone who can speak to a program that does this.
Exactly. Those are great points in terms of exercise leading to psychological effects for individuals with MDD and PTSD. And one example of such program is a surf therapy program at Naval Medical Center, San Diego. So Betty, talk to us a little bit about what's special about the setting of this program.
Hi, and thank you for having me. What is special about the Navy Medical Center San Diego Surf Therapy program is that it is a part of the medical care that is offered for our patients. Our patients go and see their providers. There are different providers with the different medical diagnoses, and they're referred to health and wellness, to self-therapy. Many times a patient in the civilian world will talk with their providers, with their psychologist or with their medical provider, with their primary care provider, and they will be told that they should go out, they should get busy, they should go find a hobby. This is nice for somebody that have the drive to do that. Many of our patients do not have the drive to do that because of their diagnosis. They may be suffering from post-traumatic stress disorder, PTSD, or from major depressive disorder, and they may want to crawl into a dark room and just stay there. Or they may develop social anxiety. And the thought of being in a busy beach with screaming children and a lot of people may be exactly what they would want to avoid. They just may not have the energy. They want to think about it, but they are depressed, and this is complicated, and how do you go about it? And they just don't do it. So the advice of the civilian primary care provider or the psychologist is really a good advice. They need to do what's called opposite action. They need to do exactly what they don't feel like doing, but they do not have the drive to do that. So in the Navy Medical Center setting, their provider will send them to the health and wellness. They will be seen by the provider in health and wellness and will have a medical appointment for self-therapy. So now it's not for them to create the situation. The situation is created. Their place of accountability is in the self-therapy. Their place of accountability is on the beach. They're military people, and they will usually be where they need to be, where their place of accountability is. And they will be at the beach. And once they're there, they'll be exposed to all the benefit of self-therapy. Once they're there, they'll be exposed to, they will be surrounded by, they will have the camaraderie of their other service members. They'll be surrounded by a supportive community. The self-therapy we work with a lot of community volunteers, and it is great because not only our patients who many times are working on community integration, not only our patients are getting their community integration, the community is getting military integration too. So they will be out there and they will be doing what they need to do. And many times they will come to us after and say, you know what, the last thing I wanted to do this morning was to go surfing. I didn't sleep at night. I had nightmares. I was up all night. I did not want to come here. I'm so glad that I had to because of the medical appointment. So this is what I think is very, very special. The fact that the self-therapy is a part of the medical care.
And it's great because the program wasn't founded necessarily to treat individuals with PTSD and major depression, but the way it has evolved and the appointment really helps individuals struggling with symptoms to make that commitment in order to get the treatment.
This is absolutely true. Just like as Chris was saying earlier, I'm an exercise physiologist, and I was thinking about the physiological effect of exercise. It's a great workout of surfing. It is a great workout. But it's interesting because I should have known that every time we go to the beach, every time we go surfing, yes, we feel better. Yes, we feel energized. Yes, things get different perspective, and it should affect depression. And but I didn't take it there until I looked around and saw what was happening. And so yes, you're absolutely right about that. I often think about self-therapy. I often think about surfing as a medication. Only all side effects are good. So maybe somebody come to surf, for example, originally for the exercise, for the physical activity, but then they go out and they do community integration. They have socialization. They make friends. You were mentioning earlier that many times they don't sleep well. Well, after a good session, maybe your sleep won't be perfect, but it most likely will be better than it would be had you not been out. So it's like a medication that all the side effects are good.
Excellent.
So can I interrupt? I'm
Sure.
so fascinated about this. It sounds like, to clarify, that's prescription surf therapy in the United States. Like, bravo to you, because that is what's happening. And obviously that's a big vision for ISTO, is for universal accessibility through prescription ultimately, but you are the leaders in the US. I know you know what's happening in the UK through the BBC Children in Need program and the National Health Service, but there are not other programs in the United States, at least certainly with this much structure involved. I'm probably yelling, aren't I? Because I'm all stuffed up.
You're not.
But that is just amazing. I love to hear that. Do you feel like this can be replicated at certainly other, military branches? To all of you, I guess that question.
Absolutely. Absolutely. I must say that I feel very blessed to be a part of the Navy Medical Center. It's such a big organization. For the Navy Medical Center to have the vision to create a situation. Yes, since 2008, we are where the Navy Medical Center is where we all want to be, where self-therapy is prescribed, is a part of an integral part of the medical care. It is amazing. I want to say ISTO works with many nonprofit organizations that provide self-therapy. I think it's the beauty of it is in our setting, we're like the jumpstart. As we said before, patient might not have the drive to go on and surf on their own and to seek, to look for it, to find it, to set it up. We start them on this 6-week program, and after that, our goal is for them to be able to surf, to utilize the medicine of surfing safely and independently. And this is where all the nonprofit organizations that are around comes so handy, providing a community, providing a place for our patients that now own their surfing. They develop ownership on their self-therapy. They have a community to go and do it with. And to answer your question, what we're doing, I am so glad that my path crossed Kristen Walter and Otis, because what we need, I believe that what we need in order to make it happen, to make it a mainstream, is research. We all look around and we see the benefit of self-therapy. But when we have the research happening, this is how we can bring it to the next level. I'm so blessed to have you and ISTO cross our path, providing this platform to show what we're doing. And hopefully, yes, it will become mainstream. It will be part of the medical care everywhere.
Yeah, Betty, that's a great segue. So, we've talked about comorbidity. We've talked about the program and how it can address individuals who have PTSD and depression. So, Nick, when you saw out to do this study, what were you hoping to examine?
So the study itself, this comorbidity study that we'll talk about, was built off of an existing piece of work that came out, from the surf therapy program at NMCSD. And that was our previous study. And we had a program evaluation of this wonderful program, and found essentially that there were improvements across the course of the program in depression, in symptoms of anxiety, of positive and negative affect, and also in those with probable PTSD, improvements in PTSD symptoms too. And so kind of building off of that, we thought about how some things we've already discussed here were that, there are evidence-based treatments for PTSD, for depression, for some of those things that improved in the previous study. There's pharmacotherapies, there's psychotherapies, but not everyone has access to, benefits from, or desires those treatments. And exercise is really great because it can address some of those gaps of traditional treatments. I mean, even others, such as side effects, right, as Betty talked about earlier. And so, given the fact that in our previous work, we'd seen, surf therapy improve symptoms of PTSD, of depression, and knowing that the larger exercise literature also supported that it improves symptoms of these disorders, we wanted to look at how surf therapy affected people with both disorders, with both PTSD and depression, because we know that their co-occurrence is more common than not. And so what we wanted to know is, how do those with both PTSD and MDD respond to exercise, in this case, surf therapy, when compared to those with only one disorder?
And what did you find?
Well, that's a great question. I guess I should probably also, just building up the anticipation, briefly describe kind of the program so that people have an understanding of how we looked at this question. And so Betty mentioned this program that counts as a medical appointment at the Naval Hospital. People have these weekly surf sessions. They surf for 3 to 4 hours, and this program goes on for 6 weeks. And so at the beginning of the program, we give them what I call the macro assessments. We gave them this assessment packet, and we basically used this for in our study, diagnoses and kind of descriptive data. So the way that we kind of categorized people into having a major depressive disorder or post-traumatic stress disorder is based on these measures that we had that we can apply to diagnostic criteria. So the short of it is, we put them into these categories based on a self-assessment. And then at every session, before and after, they surfed, we give them what I call these micro assessments. And they are these short assessments that people use that look at their depression, anxiety, and their positive affect. So we can look at what is the effect of that surf therapy session, those 3 to 4 hours. And so these little micro assessments are what we used for this study in particular. And now I'll get to what we found, which is that we saw that both groups, both the group with both disorders, PTSD and depression, and the group with only one of them, both improved, which is great. But the other thing, and the main finding of the study, was that we found that people with both disorders actually improved more on symptoms of depression, anxiety, and positive affect when they're compared to the single disorder group.
And so what do the results of the study mean for surf therapy programs more generally?
Mm-hmm. So I think the important thing to note is that, and I'll do this really quickly, is that when you have a group that is more severe to begin with, in terms of symptoms, they have farther to fall. They have farther to come down, right? Compared to a group that starts maybe down here on their symptomology. So we did our best to mitigate the effects of such a thing. It's a statistical thing called regression to the mean. And at the end of the day, what does it mean for surf therapy programs, I think, is the most exciting part. And with the statistical stuff aside and mitigated, the effects of surf therapy appear to be global in nature. That's what we've talked about before, that they're not specific to one disorder and that they target multiple symptom types. And this is important because there are a lot of kind of traditional treatments or evidence-based treatments for PTSD, for depression, like Kristen talked about, that are targeted, right? They're targeted to one disorder, they're targeted to PTSD, they're targeted to MDD, but that surf therapy with this global symptom improvement looks like it addresses maybe multiple symptoms of multiple disorders, which is perhaps why the comorbid group did better. And the other exciting thing too is that surf therapy not only reduced negative symptoms of depression and anxiety, but it also increased these positive ones by increasing positive affect. And this is also important because even in successful treatments of something like major depressive disorder, people's depression has clinically remitted. You still have low affect as being something that exists, even when it's successful treatment. And so the fact that surf therapy improves these positive symptoms is really important because it kind of addresses this gap in clinical care. And it really, for surf therapy programs at the end of the day, says, this is a really good, perhaps an adjunctive treatment to traditional care. It's a good kind of tag along to traditional care. And that's exactly what's done at the Naval Hospital too. And so there are some implications for this that I think folks who are really involved in surf therapy programs at ISTO probably already intuitively know, which is that something like surfing reduces stigma for mental health treatment because it's not seen particularly as a mental health treatment. It's seen as like this, a physical type of thing, exercise, that it increases treatment options, again, for people that don't want traditional treatments or don't have access to them or things like that. And I think those aside, one of the most important things in this area is that you have people, as we've talked about, that are behaviorally have these barriers to exercise. It's this catch-22 where like exercise is really good for your mental health, but your mental health may prevent you from exercising. And the great thing is that this goes along with existing literature, this program that shows that these outcomes are possible, and it's possible in these populations with major depressive disorder, with PTSD. It's possible when these programs are guided and when they're progressive. And we have this 6-week progressive program where people might start on land learning about surfing and maybe get to boogie boarding and then maybe end up surfing with an instructor the whole time. And so I think the implication that it's possible to have vulnerable groups like this be able to exercise and improve is a really big takeaway.
Excellent.
Yeah.
Oh my gosh, I love that so much. And I think the other thing is, back to your point about how, gosh, if you're feeling depressed or you're struggling with any kind of mental disadvantage, it does preclude you from like wanting to go do the thing. Yeah. But then you go surf, and who doesn't want to continue to surf? I mean, I think about people who are sort of forced into going to see a therapist or a psychologist, and nobody's like clamoring to get back to the therapist's office and the couch and sitting there, but it's so rare that somebody who goes surfing one time doesn't want to do it again. And I think a big part of what I've seen is, well, one, they're not being therapized out there, right? It's just the elements of the healing powers of the ocean, and obviously building this community, and all of that's sort of happening organically. And we don't actually have to do much. We got to get out of the way, but we just kind of let that happen. But that's really interesting, Nick, because it is, I think what we're seeing in PTSD and many other mental disadvantages is that it's about maintenance, right? It's not, oh, I went surfing once and now I'm fixed. Like, I mean, we know that personally, right? It's not just like a one-time thing. So love your program.
Right. If I may add, I'm looking here at the paper that we are talking about. I don't know if we can see, and there's a graph of the patient health questionnaire and the positive affect schedule. I don't know if you can see that, but you see that the effect of the self-therapy, the self-medicine works. It gets better, and then you lose it. And then it gets better again when you go surfing again, and then you lose it. It's exactly what you were saying. It's the maintenance effect. So basically, it's like a medicine. You take a dose, it helps you through the day, and then guess what? Tomorrow you need another dose. And then guess what? Back to the idea of the side effects that are all good. It's good for you to be out there every day and get your workout anyway. And it's good for you to be out there every day and get physically tired so you will sleep better and get out and be with the people you enjoy spending time with. So it's a medicine that every day you need a dose, and the next day you need another dose, and the side effects are all good. And also you were saying, so yes, it's a holistic approach. Many times in the more traditional modalities, patients with PTSD and with depression will be focusing on the things that are wrong. With them, they're looking inside them. It's a process they need to do. But once they're out there surfing, they are out there in the universe. It's people that surf know the feeling of looking to the beach and everybody looks so small, and you feel a part of the universe. We have this red tent out there, this red canopy. And I had this PTSD patient. We were sitting out there, and he was looking in, and he was saying it makes him look at things with a different perspective. So this is the holistic side of it. And it is so simple, really. The simplicity of just going surfing is really attractive, because once the people know how to go about it, they own it and they can do it on their own. They can go out and just surf every day, get their medicine every day.
Yeah, and I
it's
think
very empowering.
So, yeah, something else to add to this conversation of maintenance and adherence and things like that, which is really vital, is that in this population in particular, this comorbid population with both PTSD and depression, they are at greater risk for also having physiological or physical comorbidities as well, like cardiovascular disease and things like that. And so the fact that you have this exercise as a way to improve mental health, but also improve physical health, is really important in this population. Yeah.
Yeah, Dr. Walters mentioned earlier also the substance use disorder that many times comes with major depressive disorder and PTSD. I remember I had this patient that he got hooked on surfing, and he started surfing, and only years later he told me that he was actually dealing with he was drinking too much. He was dealing with this problem, and he got tired of not waking up in the morning to go and surf. So he stopped drinking, and I didn't even know. So these are all these side effects that we don't even think about, but they are all good.
Yeah, I mean, how many of us like don't want to wake up with a hangover for dawn patrol? again, I think it's just organically happens. Especially if you really get into surfing, you want to wake up early, you want to be in physical shape, you want to feel confident in the ocean. All of these little pieces start to sort of mend and meld together without us having to like preach it. You know, you didn't have to tell him, hey, stop drinking. You didn't even know he was drinking. It's like your body's going to tell you what you can and cannot do and what you can, and, you know, so where are we at? Are we almost?
Well, I think one thing that is left to talk about, and is perhaps the most important piece, is that, you know, one of the goals of surf therapy, you know, in our work is that, you know, we make surf therapy an intervention that may be covered by insurance. This is something that we touched on earlier, and I didn't quite want to get into it because there's a lot of rich conversation around it, but that, you know, Kristen, like in terms of this conversation, what data does future surf therapy research need to provide really in order to support this goal of insurance coverage of some sort?
Sure. To briefly summarize, overall, outside of research that would support potentially insurance coverage, I think it's important for us to move towards having comparison groups, having common metrics and standardized assessments. So that's just an overall. But if we're thinking about insurance coverage, there are things that insurance companies are probably looking for. So for example, individuals like taking a look at surf therapy and seeing, does it actually benefit the disorders that we want it reimbursed for? Does it improve symptoms and functioning for those individuals? How does it fare compared to our existing evidence-based treatments in our standard care? If it doesn't fare well, maybe on its own, how does it look when we augment existing interventions with surf therapy? Are there enhanced effects? Because if surf therapy enhances standard care, then I think that's a really compelling thing to look at. Also, we're starting to understand the components of surf therapy, but seeing what aspects produce the most change is important. And also getting an idea of how much dosing do we need in order to yield the benefits we're looking for. So these are all different aspects of, you know, essentially clinical science that can help inform outcomes so that insurance companies might consider reimbursing for surf therapy.
Yeah, I think that's a great point, because it's the ultimate goal in some sense, and that there has to be a robust clinical, you know, robust evidence base in order for an insurance company to make, you know, such a designation. Like, you're not going to get prescribed, you know, an antidepressant for high cholesterol, right? You get prescribed a statin for high cholesterol because there's an evidence base backing what it does. And I think the same, as you say, the same type of scientific rigor needs to be applied in these cases that concern psychological disorders and treatments like, you know, surf therapy or whatnot.
Mm-hmm.
Yeah.
Well, I think we're still in its infancy, but between the three of you, you have broken and shook the ground in research, because you really are setting those standards that others are going to want to emulate and duplicate. Because you're right, if it's not for randomized control trials, I mean, and building that evidence base, it's going to be very difficult to get the buy-in from your nurse practitioners and your MDs. It's just not going to happen. And we understand that. You know, I know we all understand that. It's interesting how just for so many people personally, we get how it affects our lives or impacts our lives in a positive way. And yet we're out here, you know, with like with surveys pre and post, and then 30-day follow-ups to prove how it feels. And we're like, really? Do we need all that? But yeah, I honestly, it's just incredible what you're doing. And so for everybody listening in, when will your RCT be wrapped up?
The RCT is officially now wrapped up. We are in the process of double entering and cleaning data so that we can start data analysis in the upcoming months.
Wow. How does that feel?
It feels good to be able to move and answer the questions that we sought out. And it's been, a couple years of data collection. So it's really exciting when the data get entered and then we start the analysis process.
Yeah, it's like your baby. You guys have sort of given birth and now you got to go watch your baby go out into the world, because obviously once you have analyzed and written everything up, which will take some time, we will share and spread it wildly. I really want you all to come back so that we can do a Q&A with everybody, for all of the people who are going to yell and scream at me and say, why did we not get to be a part of this conversation the first time around? But it's so exciting that it's wrapped up. And can I ask, I don't know if I can ask this, but what does that mean if the RCT is wrapping up? Is there a follow-up research project that you all are partaking in, or what's next?
There is not a funded project going upcoming yet, but we do have ideas in mind. And the good thing about the RCT is that we have so much data. We have Fitbit data, we have psychological data, we have diagnostic data. And so while the main outcomes paper will be important, we will be able to answer a lot of different questions with the data we have. Just because we have so much, we do have a comparison group for all of it. And so we'll be able to do a number of secondary papers answering other questions with the same data as well.
Well, and I hope that that does ultimately lead to funding, because that is what we talk about. So many of these programs out there that first reached out to us were not collecting data, not whatsoever. And because it's a criteria to be a contributor to the International Surf Therapy Organization is to be collecting data or contributing to the data and research, they have seen that of course, the effects of that are that they can put these into presentations and deliver them to these corporate sponsorships and et cetera. So ideally, what comes out of your hard beloved labor is more funding, because we'd obviously love to see your work continue on such a grand scale and get more people out there. Like, that's just the bottom line.
Absolutely. It's been a great team with this project. So,
well, I need to get down there and volunteer. So I know you're going to continue to keep surfing. 2021, I'm there. Well, I cannot thank you enough. Yes, I cannot thank you enough. I don't want to cut anybody off, but I cannot thank you enough. And again, this is going to be part 1, and then we'll go on to part 2 in 2021 with, I imagine, a little bit more analysis under your belt with this particular data, not to try to get the first scoop of that, but I might try to time this right. And again, we'll go live with the entire sector and allow people to be able to kind of dig in a little bit deeper. I know that there's a lot here and it's hard to do it in 35 minutes. So I appreciate your guys' time. I'm so impressed by your work. And Nick, it's really interesting to see somebody, I mean, I'm just going to say it, at your age, really excited about a side that not a lot of researchers are, a lot of surfers and or just sort of active people who are physically active are wanting to dive into. Just the other day, Gregor was saying, I was saying, gosh, there's not a lot of researchers, certainly in surfing. And of course, Gregor joked, thank God but I mean, it is really lovely to sort of see this next generation come up and say, well, we kind of want to dig a little bit deeper and have a little bit more understanding. You know, the generation above me, I mean, they just surfed, right? And I mean, if you go way, way back in the beginning of the days, and it was the Polynesians, they're just surfing, the kings and the queens, everybody's just surfing because it probably felt good, but nobody felt the need to define anything. And it's such important work. And I mean, honestly, Nick, thanks so much for saying, I want to study this and I want to dig a little deeper. It's important.
Yeah, it is. I think the most important thing is to find treatments that can reach the widest, cast the widest net, you know, whether that's surfing or in our randomized control trial with hiking, which is, you know, perhaps more accessible and things like that, we find treatments that can reach kind of the most, the widest, cast the widest net to reach the most people. I think that's the most important thing in my mind.
Yeah, there's this massive push, of course, to get to nature. And for us, you know, we're a little biased with our nature being the ocean or Mother Ocean, but absolutely. I grew up in the Pacific Northwest. Hiking was just, you did it every weekend without ever even thinking that there were benefits to it. It was awesome to be in the mountains. It was fun to be, you know, 20,000 feet up in the air, because Mount Rainier is one of our, well, actually it's not 20,000, it's 14, but still it was always fun to be like up, you know, where your breath was a little bit, you know, altered and changed, and sort of just like in surfing, right? You're pushing your body to do a little bit more than you think you can do. And I mean, it's fascinating. So anyway, thank you so much for being here, Betty and Kristen and Nick. I'm so grateful to you. Honestly, I can't say thank you enough. Thank you.
Thank you for
Thank
having
you,
us.
Chris.
Absolutely.
You're amazing. Thank you, Isto. Thank you, Chris.
Our pleasure.
And thank you, Kristen and Nick.
You.